Social Problems Analysis, Childhood Obesity by Owen Chastun. What is obesity? The grounds. Obesity is a chronic disease that has only been growing in the United States. According to the CDC, obesity is defined as having a body mass index at or above the 95th percentile of the CDC's sex-specific BMI for age growth charts. Obesity is heavily associated with high blood pressure and high cholesterol, which are factors for heart disease, type 2 diabetes, breathing problems such as asthma and sleep apnea, joint problems, gallstones, and gallbladder disease. Obesity, especially childhood obesity, can be associated with socioeconomic status. According to the CDC, it has been found that in children from 2 to 19 years old, the prevalence of obesity decreased as the head of household's level of education increased. The warrants. Why is it that in a country, the poorer people are also the ones that are fatter? Well, there are many factors that affect both children and adults, and this is a map of the prevalence of obesity by percentile in each state. Some of the biggest factors that contribute to excess weight gain include eating patterns, physical activity levels, and sleep routines. Social determinants of health, genetics, and taking certain medications may also play a role. For those wondering, a social determinant of health, as described by the CDC, are the conditions in which we live, learn, work, and play. Supporting sources. The Center for Disease Control explains many grounds, claims, and warrants covering the issue that is childhood obesity and obesity altogether. They also provide many conclusions. Our federal government has released official guidelines for dieting listed in a website journal known as Dietary Guidelines for Americans. The High Obesity Program, an article published by Oklahoma State University, is a program that targets universities to create a more direct source of help for those who are suffering with obesity. The CDC as an activist. Childhood obesity is a problem that is being federally addressed. However, we need more individual action as a nation. The Center for Disease Control is the biggest resource there is in the United States that covers obesity and other diseases. The CDC has been surveying the nation and recording all of the data to be posted on their website. At the moment, about 42% of our nation is obese and about 35% are just overweight. This means that there are many more activists and experts working on this issue than just the CDC. In fact, the CDC has listed multiple initiatives that are taking place in healthcare providers and other health systems which implement strategies that prevent or manage excess weight for health during childhood. CDC as an expert. Since the CDC is a government-funded facility, all experts who have been working on the issue, both past and present, have been thoroughly background checked and verified through many systems. There are hundreds, maybe thousands of employees who are doctors that are working on researching and developing medical treatment for obesity. There are also many who are surveying the United States population for useful information pertaining to many kinds of issues, ranging from obesity all the way to COVID-19. Many of us are familiar with. All of these experts are reporting constantly to the CDC, and the CDC has been constantly updating information on varying range of diseases. This is all posted on their website. Here's my potential conclusion. The first part of my conclusion proposes that communities should create food areas that promote healthier restaurants and at the most maybe even ban restaurants that are purely unhealthy and restricting the marketing and advertisements of unhealthy foods. The second part of my conclusion calls for larger organizations and governments to create areas with better living environments. That is, that residential and business areas could be closer and or better connected while being protected or protective in some way to create safer areas for everyday recreational activities and better exercise. Support for my conclusion. Since it is known that obesity is often caused by improper dieting and lack of exercise, CDC has stated that some states and communities are not only pushing for healthier restaurants but also for safer park areas and communities to encourage exercise. In the article, How to Win the War Against Obesity, K.M. Zellman strongly promotes a diet full of produce and complex carbohydrates while discouraging saturated fats and other refined carbohydrates. Baylor University's article, How Should We Reduce Obesity in America, calls for 3 options that are needed. Community stance against obesity, improving production and marketing of foods, and finally, creating a culture of healthy living and eating, meaning communities of better, healthier eating and recreational activities. Now, what is the impact on social problems workers? Concerning childhood obesity, pediatricians must carefully analyze and record data regarding any potential health issues in a rapidly changing body. This includes height and, of course, weight. If a child's body mass index reads too high, it means that they are either overweight or obese. As stated by Sarah Bleich in an article published by Johns Hopkins Bloomberg School of Health, in measuring the effectiveness of community-based programs that impact childhood obesity, more comprehensive interventions are definitely better. In other words, a community that is strongly bonded together and all together are fighting against obesity have a much better chance than just individuals who are fighting obesity. These interventions include anti-obesity combat at the state, community, and especially individual levels. Potential critiques. Potential critiques of policies are that a policy is insufficient, that a policy is excessive, and or that a policy is misguided. If the policy is insufficient, then my conclusion does not provide enough action to beat obesity. If my policy is excessive, that would mean that these critics are claiming that perhaps only dieting or only exercise is needed, not both. And if my policy is misguided, that would mean that I do not truly know much about obesity.